The promotion and widespread use of fluoride-containing mouthwashes reflect a familiar pattern in the intersection of health marketing and consumer behavior, a legitimate medical tool repurposed into a mass-market product, oversold far beyond its actual need. Fluoride, when used appropriately, is a proven agent in the prevention of dental caries, particularly in populations at high risk of tooth decay or with limited access to fluoridated water. However, the rise of fluoride mouthwash as a daily-use consumer product, particularly among low-risk individuals, has outpaced the clinical necessity and scientific evidence supporting its benefits in such groups. Companies have seized on fluoride's reputation and marketed it as a premium, must-have ingredient for superior dental health, often without clear guidance on dosage, necessity, or potential risks of overexposure. This has turned an otherwise valuable compound into a profitable, but sometimes redundant or excessive feature in oral health regimens. At the core of the issue is the disconnect between clinical need and commercial messaging. For individuals already brushing twice daily with fluoride toothpaste and drinking fluoridated municipal water, the marginal benefit of adding a fluoride mouth rinse is extremely limited. The American Dental Association, ADA, and other professional organizations generally recommend fluoride rinses only for specific groups, such as those with a history of cavities, orthodontic appliances, or dry mouth conditions that increase caries risk. But these caveats are rarely made explicit in advertising. Instead, fluoride is presented as a universally beneficial additive, with marketing language promising stronger enamel, fewer cavities, and next-level protection. In this context, mouthwash becomes not a targeted medical tool, but a product of aspirational health, a way for consumers to feel proactive and responsible, regardless of their actual dental risk profile. This distortion is profitable. Once a niche product recommended by dentists in specific cases, fluoride mouthwash has been elevated into a daily use staple through branding, packaging, and psychological reinforcement. Bottles labeled with phrases like maximum cavity protection or clinical strength fluoride play on consumer fears of tooth decay and aging, without offering meaningful education about who actually needs these interventions or how fluoride dosing works. It's no surprise that many people, especially parents, are led to believe that children and teens should use fluoride mouthwash in addition to brushing, even though doing so may result in excessive fluoride exposure in a population already consuming fluoridated water and dental products. The health risks of such overuse are not catastrophic, but are far from negligible. Chronic ingestion of excessive fluoride during early childhood can lead to dental fluorosis, a condition characterized by white spots, streaks, or mottled enamel that, while mostly cosmetic, can cause psychological distress and require aesthetic correction. In more severe cases, especially in areas with naturally high fluoride levels in water, skeletal fluorosis can develop, leading to joint stiffness and bone damage. These outcomes are rare in industrialized nations, but are made more plausible when fluoride is present in multiple overlapping consumer products, including toothpaste, mouthwash, bottled water, and even processed foods made with fluoridated water. Children, in particular, are at risk of swallowing rather than spitting out mouthwash, a factor often overlooked in parental purchasing decisions shaped by marketing rather than medical advice. Yet despite these risks, regulation of fluoride content and labeling in over-the-counter products remains uneven. In many countries, there are no strict requirements for manufacturers to include dosage warnings tailored to a user's existing fluoride exposure. Nor are consumers given much context about the diminishing returns of fluoride after a certain threshold. Instead, companies benefit from the ambiguity. The more that consumers associate more fluoride with better care, the more room there is to introduce premium products with higher fluoride concentrations, new delivery formats, gels, rinses, pastes, and higher price points. Dentists themselves are often caught in this dynamic, with some recommending fluoride rinses without considering total exposure or individualized risk. Others may remain silent as patients add layer after layer of oral hygiene products out of fear, marketing influence, or misunderstanding, ironically increasing the likelihood of fluorosis or chemical irritation, especially with overly harsh formulations or improper use. The cumulative effect is a marketplace in which fluoride's science-based legitimacy is used to justify a cascade of products, some of which offer no measurable benefit and may carry subtle but unnecessary risks. This overpromotion of fluoride mouthwash also highlights a broader problem in the consumer health landscape: the exploitation of scientific trust. Fluoride has been one of the most successful public health tools in modern dentistry. But by using its credibility to push unnecessary products, companies risk undermining public confidence in fluoride itself. Anti-fluoride activists and conspiracy theorists often point to excessive product availability and unregulated dosing as evidence of systemic recklessness or collusion, an argument that becomes harder to refute when even health-conscious, low-risk users are encouraged to buy and use fluoride mouthwash daily without clear rationale. In the end, fluoride mouthwash overuse may not be among the most dramatic examples of public health distortion, but it is emblematic of a deeper issue: how health science can be repackaged into a sales pitch, and how even safe, beneficial compounds can be transformed into overused commodities. In the pursuit of better dental care, many consumers are unknowingly exposing themselves to more fluoride than they need, not because of medical advice, but because of marketing that blurs the line between smart prevention and unnecessary supplementation. It's a small but telling case of how wellness can be sold not through deception, but through the careful amplification of a half-truth, profitable, persuasive, and hard to question without a deep understanding of the science.